It's time to sign up for health coverage on healthcare.gov for coverage that will be effective in 2019. But with all of the political conversations and all of the chatter that's been happening, it's all right if people are a little confused about what is actually happening on healthcare.gov or with Obamacare generally. So we're going to pause and take a few minutes to just debunk a few Obamacare myths during this open enrollment period. First and foremost, the Affordable Care Act is still the law of the land. There have been attempts to repeal and replace the Affordable Care Act. There have been attempts to chip away at pre-existing condition protections for people. There is a lawsuit, the federal lawsuit going on in Texas right now to try to chip away at the individual mandate and maybe even scrap the whole Affordable Care Act. But none of that has changed the fact that the Affordable Care Act is the law right now and will carry us through open enrollment into the 2019 plan year. So that means open enrollment runs November 1st through December 15th for coverage that will be effective January 1st, and healthcare.gov is still your place to go and purchase insurance. Number two myth. Many people think the individual mandate has gone away because of all this political chatter and the lawsuits that are happening. The individual mandate does still exist. This is the rule that says you have to have insurance or pay a penalty. That is still true right now. The GOP tax bill has changed the way that the penalty will be figured moving forward. It says it'll be zeroed out for the 2019 coverage year to be reconciled on 2020 taxes. But if you don't have coverage in 2018, come April 2019, you could still owe a penalty for having been uninsured in 2018. The individual mandate still says everybody has to have insurance. The individual mandate means more than paying a penalty for being uninsured as well. This is the hook that gets us to comprehensive coverage for everyone that then attaches things like pre-existing condition protections and limits on whether or not an insurance company can cap how much insurance you can use. It gets rid of some of those negative impacts of insurance that all happens in that same section of the Affordable Care Act. So the individual mandate, guaranteed availability, and making sure that coverage is available and affordable all comes through that section of the individual mandate language that is so important. Subsidies and tax savings, are those still a thing? Yes, they are still available. Again, two different types of financial assistance are available in the marketplace. Tax subsidies, if you're between 100 and 400% of the federal poverty level, you will qualify for subsidies that bring down your premium amounts. If you are between 100 and 250% of the federal poverty level, you may qualify for additional cost-sharing reductions, which bring down the cost of out-of-pocket costs, such as deductibles or coinsurance. So there are tax and cost-sharing savings still available in the marketplace. Political chatter has impacted dramatically cost-sharing reductions because the federal government said it doesn't want to reimburse insurance companies anymore for passing on that savings to consumers. So while they're arguing behind the scenes, the law still says if you're a consumer and you meet the eligibility criteria, you get cost-sharing reductions. So tax subsidies and cost-sharing reductions, still a thing. You are still going to benefit from cheaper insurance if you qualify in the marketplace. Do plans have to cover pre-existing conditions still? Absolutely. Plans must cover essential health benefits. And this doesn't just apply to plans inside the marketplace. This is the rule that applies to plans outside the marketplace as well that are comprehensive health plans. Now, pre-existing condition protections means that plans can't discriminate against you if you had a condition that existed before the effective date of that plan. That protection has been one of the most popular in the entire Affordable Care Act. And as some politicians are knowing now, when that was threatened, it could become a big voting issue. So there is a big drive to make sure that people understand if you are buying a marketplace plan for 2019, it will come with pre-existing condition protections. There are some plans being sold out there right now that are short-term, limited duration health plans. They are not comprehensive coverage, and those do not have to follow pre-existing condition protections. So make sure you know and understand the plan that you are looking at, that you know what protections come with it, what cost savings come with it, and make sure that you have that conversation with whoever you're sitting with, an assister, an agent, or broker. Ask those questions. Does this plan come with tax subsidies? Does this plan come with consumer protections like pre-existing condition protections? That is an important conversation to have so you don't end up signing up for a plan that doesn't have those protections. Finally, shop around. There is a feature to auto-renew. And there was a lot of discussion. If you had a health plan in 2018, can you just keep that in 2019? The answer is yes, but you're going to want to compare. You could be renewing. If you do nothing and you have health coverage for 2018, you're going to renew into a similar plan to what you have right now. It could have different costs. Your tax subsidies might be different. You might be in a different network. A lot of changes can happen if you just auto-renew, thinking you're getting the same thing. So make sure you shop around. There is an option on healthcare.gov to say, I had health coverage in 2018. I just want to update my information, and I want to shop for potentially a new plan in 2019 or keep the plan I had in 2018. That is a separate button from I'm starting new for the first time, I'm uninsured, and I want to buy a health plan for the first time. So you have the option to say, I have a health plan, I want to update my information in case my income or my household has changed, and I also want to see what my plan options are. So shop around. It's worth logging into healthcare.gov to make sure you don't have surprises in 2019. Another myth, some people just get confused of open enrollment. Does that mean that all health programs have open enrollment right now? Medicaid, BadgerCare Plus are always open. You can apply for Medicaid at any time. Open enrollment that we're really stressing as being November 1st through December 15th is for the individual private insurance marketplace through healthcare.gov, or if you're working outside of the marketplace on an individual private plan. That's the open enrollment period we're talking about. If you are Medicaid eligible, you can apply at any time. And you could even have your coverage made retroactive in some instances. So make sure you know the difference between the public benefit or the individual private insurance world. We have a couple resources that could help as you're trying to debunk some of these myths yourself. The first one is just to make sure that people know what they should have handy as you are sitting down to healthcare.gov for the first time, that marketplace checklist. Reporting changes, we mentioned that, so we give you some instructions if you do have a life change or a change of income, how to make sure the marketplace knows that, so your tax subsidies or your coverage is what you think it's going to be moving forward. And finally, finding some local help. If you think you're going to need a little assistance or you have more questions, you can contact these folks and they're going to point you in the right direction. You can always send a story, a question, or an email our way, and you can do that at healthwatchwisconsin.org.